Hello, my name is Ashley Wysocki, and I am here with my grandparents today. And I am here to talk about why plastic surgeries that better one's health should be included under their health insurance plan. Taking care of yourself can be quite expensive, depending on what needs to be done. Reconstructive surgeries make no exception. These surgeries are defined in the dictionary as a process of reconstructing or repairing parts of the body by the transfer of tissue, which restore function or normal appearance by reconstructing defective organs or parts. Both types of surgeries have been around for more than 4,000 years. In fact, physicians in ancient India were utilizing skin grafts for reconstructive work as early as 800 BC. These skin grafts can be used in a medical, life-saving sense, or just to improve someone's self-esteem. Unfortunately, health insurance does not cover plastic surgeries in either of these cases, which can be very detrimental to someone who may need surgery like this but cannot afford it. Our skin is the largest organ in the body, and it can tell you a lot about your overall health, so it is important to take care of it. As the sun becomes hotter and our skin more vulnerable to its ultraviolet rays, moles and the presence of skin cancer have become more prevalent. According to a report in 2015 from the CDC, the number of new cases and deaths from melanoma cancers is going up. In another study in 2014 from the United States Department of Health and Human Services, nearly 5 million people are treated for all skin cancers combined, with an annual cost estimated at $8.1 billion, and $3.3 billion of skin cancer treatment costs are attributable to melanoma. Mentioned later in the same study, the statistics show that melanoma is responsible for most deaths of all skin cancers, with nearly 9,000 people dying from it each year. From a personal experience, I have been in a position where I needed cosmetic surgery to remove a suspicious-looking mole. Because of the surgery, I was not covered under my insurance plan. I had to pay almost $1,000 out of pocket just to make sure nothing will progress into something malignant. I, very fortunately, could afford this type of surgery, whereas someone else in the same situation may not have been able to afford it. Another example of a reconstructive surgery where insurance does not cover the bill is someone who has broken their nose and it heals incorrectly, obstructing their nasal passages for poor airflow. A side effect from a broken nose that did not heal correctly involves a deviated septum. According to an article written in 2017 by the Cleveland Clinic, a deviated septum can contribute to sleep apnea, which is a potentially serious condition where breathing stops during sleep. This can lead to serious cardiovascular problems, such as type 2 diabetes, strokes, heart attacks, and even a shortened lifespan, as mentioned in a medical journal from Johns Hopkins Medicine. Even though there are serious side effects to a deviated septum, it is considered a cosmetic rhinoplasty. It will not be covered by insurance. Having excessive fat in the body can also cause some serious health issues in a person's life. A type of cosmetic surgery that has some health benefits to it is liposuction. In a report of the Mayo Clinic, they describe liposuction as a surgical procedure that uses a suction technique to remove fat from specific areas of the body, such as the abdomen, hips, thighs, buttocks, arms, or neck. An example of a health benefit from liposuction includes lymphedema. Lymphedema is a chronic or long-term condition in which excess fluid, known as lymph, collects in the tissues, causing the edema or swelling, which usually only commonly occurs in the arms or legs. This liposuction is sometimes used to reduce that swelling, discomfort, and pain. Although this cosmetic surgery offers some potential health benefits, it is not paid for by insurance. Breast reduction surgery is also a very common procedure for women all across America. Unfortunately, women have to jump through hoops in order to benefit their health for this surgery. According to a plastic surgery database, a woman who is interested in this surgery must have visited other physicians about her macromastia, referrals for physical therapy, a chiropractic treatment, an orthopedic consultation, or a dermatology exam. And even with all these requirements, the woman may also still be denied her insurance. These types of plastic and reconstructive surgeries can very easily be listed as preventative care to limit or even prevent larger health risks and problems years down the road, which will drastically reduce healthcare costs on facilities. By doing so, this can also keep future health costs lower for the nation as a whole. Why would we have this expensive healthcare if it doesn't include all health aspects of our lives?